Good morning, Dr. Gary here. Dr. Gary on the road. We are we sell dental practices nationwide. We're dental practice brokers. So please give us a call. Today's topic is everything a seller for a dental practice chart sale or patient record sale wants to know. We're trying to give you current information, what's happening this weekend. So we've been doing this now for 12 years, dental practice sales, and we are now employing 10 employees that we have, 10 staff, and it's been working out great. We have 2 CPA accountants, marketing director, operations director, and 2 CPA accountants. So we're very excited about it. You can call us 363 days a year. We pick up the phone. Our hours are 7:30 a.m. to 9:30 p.m. So call us anytime. The information you're about to hear is for entertainment purposes only. It's not business or legal advice. Also, if you're thinking about selling to a DSO, please call us because we know all the DSOs, at least all the large ones out there. We know what they're like dealing with. We see the changes year to year. We are going down to the contract, letters of intent, and dealing with the attorneys. So we see the actual deal developing. And this is on a day-to-day basis. So we give you current information. So they pay our commission, and majority of them, so you will not have a commission. And sometimes we get the legal fees reimbursed at closing. So give us a call. We can explain everything. Also, sellers, if you're thinking about selling to a DSO, we can give you a free evaluation, or any seller that wants to sell. We can try to give you some evaluation at no charge of what the current values and things are going for, and some idea what yours will be. That's all at no charge. Anyway, so call us. So everything you wanted to know about selling patient records or chart sales, so to speak, of a dental office, we believe we can help you with that. Let's go talk about what's happening this weekend. Working on something right now. You have a seller that has the opportunity to sell either to a well-qualified, established dentist that wants the records and is going to pay up front. And that's about 10 to 15% of the time you'll find a buyer like that. The other buyers all want to pay as the income comes in. So it's a record sale, meaning you're only getting the patient records and phone number, and maybe one or two staff may or may not come along. But most of the buyers of the record sales want to pay as income comes in. In other words, they want the records, they'll give a very small down payment, and as the income comes in from the patients, only then will they give a percentage of to the doctor. That percentage will vary, 20%, 25%, maybe 30%. Of what they collect, and usually only the first year. The problem with that scenario is you're chasing your money all the time. You don't know how much you're going to get, what happened, who's keeping records of it. You have no clue. Okay? It takes some burden off you in either case because you're delivering all those records to the buyer, and you're not responsible for them anymore. They become the custodians of your record. So that can work out, but I don't like chasing money. So you may get less money from a full upfront record sale that pays in cash up front compared to a one that's going to pay based on income. So it's something to keep your eyes open and look at. So we have a situation now. Our seller is contemplating what should he do. Right now, what should he do? Should he take the money up front and be satisfied with it? And it will be probably less, perhaps, than the others are offering, which is going to be pay-as-you-go type thing, pay as the money comes in. That's a little more risky. So you're going to get more money, possibly. You don't know. It's venturing into the unknown. Or you sell everything down up front. The buyer takes the records. The deal is over with. You don't have to worry about it anymore. Once and for all, it's finished. You take that entire burden off your back. All right, that's the essence of it. You should still use dental attorneys and so forth for this. The buyer may ask you to sign a restrictive covenant anyway, even though you may be retiring and never going back to dentistry. He may ask you to do that, or she may ask you to do that anyway. So just be aware of that. Now, concerning the idea that you may want to just close up shop and forget it because you're not getting enough of your records, not a good way to go, because now you're responsible for all those patients' records. They'll be calling you over the next several years, send my records, send a copy of my records. It'll never end. You've got to keep your phone number available and alive. And you've got to take on that responsibility. That could go on for a couple of years, patients requesting records. Now, but the biggest problem is, listen to this carefully. You close up shop, and I've talked about this on some of my other tapes. You close your dental office, close the door, send a letter out, go find another dentist. The problem is there are certain unscrupulous dentists, let's say, that will look at your dental work, which is probably outstanding and excellent, and they will say, oh, they don't like it. Has to be redone. Speak negatively about your work. It's always going to happen. You can be really careful of that. And it does happen because the patients scatter now, and you don't know where they're going to scatter. So if somebody's buying your records, at least they have a good intention, and it's for their best, for their interest, for their best interest, to maintain the practice, maintain the patients, keep everybody happy, keep all the patients together, and watch your back. That is important. You need somebody that's going to watch your back, and that's not always going to happen. Once they scatter, they have no obligation to do that. Well, be aware of that. That is a big problem sometimes. So what's going to happen? I don't know. We're dealing with this weekend. The seller's contemplating what he's going to do. Does he sell upfront everything? Does he give the records away or sell the records and wait for his money to come in? A percentage of that, which is still the unknown. I don't care what the buying doctor promises. It's still venturing into the unknown. And of course, you got to be comfortable with the doctor too, who you're selling to. So it's going to go on. The selling doctor's, retiring. He's older. He has some things on his plate, some personal issues to take care of. But I'm trying to give him the best advice we can, and let's see what happens. But it's a lot to consider. So we'll see what happens. We'll keep you posted after this deal happens. I think the wisest thing for him to do is sell all the records up front, get out, and that's it. We keep you posted with breaking deals, breaking information. What's happening today? Not 5 years ago. This is happening today. This weekend, I was on the beach, on the phone, negotiating. And that's what happens. It's always changing. There's always different issues about. Remember what happened with COVID. The whole world changed, and no one in the world predicted that. No one predicted it. So you can't say you could figure out what's going to go on in the future. You have no idea. Just remember that. Thank you. Thank you for listening, and call us.